So I guess everybody's here who's going to be here for right now. So good morning, everyone, and welcome to this morning's session of the Joint Standing Committee on Health and Human Services. This session will be a little bit different than our others in that we'll be working on a budget document. It's 41 pages long. We'll be going through it essentially line by line, led by our fearless budget leader, Luke Lazur. And we'll be collecting questions is most of the energy for today, collecting questions on individual lines that we can try and get answers for Thursday. The intent being to vote on only things that everybody's comfortable with today and maybe not at all, but I'll be looking to committee members to indicate whether they would like to have their vote recorded by an official count from Karen or by a show of hands. And I'll defer to everybody who feels who would rather have it done one way or the other. I think for the quote easy ones, where it's simply accounting, we can do it with show of hands, but I want to respect that other folks may want to vote with hands shown, with vote recorded using Karen's recording. So with that in mind, we can introduce the committee, and we'll start with Representative Zager.
Good morning. Thank you so much, Senator Claxton. My name is Sam Zager. I represent District 41 in Portland.
Representative Lemlin.
Thank you, Senator. Good morning, everyone. My name is Michael Lemlin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Nobleboro.
Representative Griffin.
Good morning, everyone. My name is Abigail Griffin. I represent House District 102, which is Plumber, Levant, and Cadesque.
I skipped over Senator Baldacci on the right side of the horseshoe.
Good morning. I'm Joe Baldacci. I represent Senate District 9, which is the city of Bangor and the town of Herman. Thank you.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Thank you. Representative Madigan.
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Representative Javner.
Good morning. I'm Representative Kathy Javner, and I represent House District 141, which is located in Penobscot and Washington counties.
Thank you. Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan and Hancock County as well.
And Representative Meyer.
Thank you, Senator. I'm Representative Michelle Meyer, serving Southern Maine's District 2, which is all of Elliott, where I live, and parts of Kittery and South Berwick.
And I'm Ned Claxton, honored to serve the folks in Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. Today being an even more important day than usual in some regards, we are fully staffed. All of the folks here who make this possible have joined us today. So I'll start with Anna Broom.
Hi, I'm Anna Broom. I'm one of the legislative analysts for the Health and Human Services Committee, and I work in the Nonpartisan Office of Policy and Legal Analysis.
And Sam Senft.
I'm Sam Senft, and I'm the other OPLA analyst in the Office of Policy and Legal Analysis.
And Luke Lazur.
Good morning. I'm Luke Lazur. I'm a senior analyst in the Office of Fiscal and Program Review.
And Karen Thomas.
And I'm Karen Thomas, happy to be the clerk for the Health and Human Services Committee. Should you need any assistance, please email me at hhs@legislature.maine.gov.
Very good. So Karen, do you have a sense of who's on campus today, or just want a show of hands if you're on campus so we can get that recorded? So I know Senator Moore's there and Representative Javner.
Yes, and Representative Perry is around as well.
Okay, very good. All right. So with that, Luke, I hope you heard the brief introduction that mostly we'd be going line by line looking for information and answering questions, and that we will either vote by show of hands or if a member of the committee requests, we'll make an official recorded vote. Representative Stover has just joined us.
Good morning. Thank you, Mr. Chair. My name is Holly Stover. I represent House District 89, including the towns of Boothbay, Boothbay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol. Thank you.
Very good. All right, so I will turn it over to Luke at this point, and you can start with the green document or wherever you want.
Great. Well, good morning. So I'm now sharing my screen.
That's a cute family there, Luke.
Yeah, having an issue here. My screen is not showing everything.
We're seeing
All right.
we're seeing the EFY 2022 supplemental budget. Yep.
All right. So I just plan to start right at the top of the document. So we'll start right on line 1 and we'll work our way down. I plan to just sort of read through the initiative, and if there are any questions, obviously the department I know is here and can respond to those. The other thing I would note is just a brief walk through the document again. Obviously, we've seen this document before, but just to get everyone back with what we do. So you'll notice that there's a line that is white and has bold text in it. That is the first line of a specific initiative. The following lines that are grayed and do not have bold text are the other lines within that initiative. So just for as an example, this first one, lines 1 through 3 are all part of one initiative. So I will only really read the initiative text for one line of the many initiatives. If there are multiple accounts within the initiative, I'll often just let you know which accounts are included and often which funding sources, as the funding sources are sometimes different within the initiatives. So I'll try and get that information out as cleanly as I can. And then if you have questions, go ahead and ask. I'll try and give time after each initiative for questions to be answered. So with that, we'll start right at the top. We are in the area of adult behavioral health here. And the first initiative on line 1 through 3, all 3 lines are in the Mental Health Services Community account Z198. They are all in federal block grant funds. And the account just provides allocation to align with available grant resources. You'll see multiple initiatives throughout this document that have this similar text. This is just when an allocation that is in a certain account is not to the level of the current funding in that account. And as we often talk about when we go through budget or even some fiscal notes, an allocation is just the ability for the department to spend money. They still need the revenue behind that allocation. In this case, it's all federal block grant funds. So this just increases the allocations in 3 different accounts to the level of the current funding.
Number is he on? Number 1. Oh, okay.
And Luke, the accounts aren't readily apparent because there's consistent mention of department code and program code, but these all go to different lines in the budget keeping process.
So the program code is the account number.
Mm-hmm.
So Z198, and then the program is the actual name of the account. In this case, Mental Health Services Community.
Thank you.
All right. Nothing else there. I'll move on to the next initiative, which is lines 4 and 5. This is in both account Z222, which is the Dorothea Dix Psychiatric Center, and account Z225, which is the disproportionate share Dorothea Dix Psychiatric Center. And this initiative continues and makes permanent 1 Public Service Manager 3 position, funded 36% general fund in the DISH Dorothea Dix account, and 63% other special revenue in the Dorothea Dix Psychiatric Center program. This is specifically for a position that was previously a limited period position that had been included in a previous budget. This continues that position, but also makes it permanent. So that's why there is also, if you look to the position count, fiscal year 23, you'll see that there is a 1 there. That's because now that this becomes a permanent position, there is now head count associated with it. That's what the 1 is there. And you'll see that there is funding that goes along with this initiative.
And that there must be other money being moved or allocated for this position elsewhere, because that's not a lot for a position.
Nope, that's actually because this position was intended to end in the middle of June. And now that it's continued and made permanent, that funding, I believe, is just for the remainder of this fiscal year, just to get it through the fiscal year. But the making it permanent puts it into the baseline, which means that in the next biennial budget, the baseline for this position will be included.
Okay, thank you.
Senator.
Yes, Representative Gavner?
Yep.
Thank you, Senator Claxton. I apologize, but I'm just, so fiscal year, the position count fiscal year 22 is just a dash. So why are we not counting this as a position for 22 and only for 23?
Because for the remainder of this biennium, it's just a limited period position, which does not have a head count. What this initiative does is it does make it permanent, but only starting at the very end of June of 23. So that's why the position count only shows up in state fiscal year 23. So the funding was already there for state fiscal year 22 and 23 through the middle of June of 23. So the funding was already there, the position was already there. Now that it's being made permanent, the head count only starts once it became permanent, which is at the end of 23. A little confusing, but that's the reason for that.
Okay, thank you. And I apologize, Senator Claxton. I have a question for lines 1, 2, and 3, but just a logistical question.
Sure.
So this is, I understand these are programs, behavioral health, adult behavioral health. Is there a way from the department that we can know which programs are actually being funded by this line item? Not that I need them today or anything, but where do I find reference to what is actually the programs coming out of that?
Luke, is that something you want to answer, or we want to defer to Molly?
No, I would definitely defer to the department.
Okay. So let me take the opportunity to introduce Molly as a key resource here in the work. And I also see that, let's see, she went away. Okay, well, when she gets in.
Molly's with us. Deputy Commissioner Mann is with us as well.
Okay,
And the
so.
attendees.
Okay. So if Molly, it's hard to see. If Molly's here, there you are, Molly. Good morning.
Morning.
You want to introduce yourself?
Sure, I'm Molly Bogart, Director of Government Relations for the department. And it would be great to have Ben Mann join the meeting as well. He is in the waiting room. And I don't know off the top of my head, but we can definitely get you that information for Thursday.
Great, thank you.
Yeah, no problem.
The chair would like to invite the committee to not apologize for asking questions and doing their job. Just saying. All right, Luke, it's back to you. Well, I'll give Ben, Assistant Commissioner Ben introduce himself.
Thank you. Good morning, everyone. I'm Benjamin Mann. I'm the Deputy Commissioner of Finance at the Department of Health and Human Services.
Very good. Thank you for being here.
To answer the question on the table, so the increase to the block grant here, just some examples of what it's going towards is enhancements to the crisis system overall, which includes the mobile crisis line and mobile response. It also, we also use or plan to use some of these funds to expand the state's capacity for coordinated specialty care, which is otherwise known as first episode psychosis. So ahead of the main care expansion of that program, the creation of that starting in July.
Okay, back to Luke.
All right, so now we are on to lines 6 and 7. This is in the account Z222 Dorothea Dix Psychiatric Center, and again, count Z225, which is the disproportionate share for Dorothea Dix. And this restores legislative headcount and funding for one hospital nurse 3 position, funded other special revenue in the DISH account and general fund in the Dorothea Dix Psychiatric Center account for the new 18-bed inpatient unit at Dorothea Dix Psychiatric Center. This position was authorized in Public Law 2019, Chapter 343, but not included in the baseline budget enacted in Public Law 2021, Chapter 29 due to a technical error.
Okay.
All right, no questions there. We'll move on to line 8. And this is in the account Z225 disproportionate share Dorothea Dix Psychiatric Center. And this provides funding for the increased cost of travel nurses at Dorothea Dix Psychiatric Center. And this is all general fund appropriation.
Okay. Question from Representative Javner.
Did we get a sense of how long those were going to last? I know when they came before us and testified, even they were talking about a timeline. Can someone just remind me of what that would be?
We're requesting funds in the baseline for this. I can't, it's hard to predict the future given the volatility with some of the staffing costs and agency costs and travel nurse costs. But we made a reasonable estimate here for both fiscal 22 and 23 to increase the baseline funding for the contracted services that are needed to meet staffing ratios at DDPC. And there's a similar initiative for RPC as well.
So this is best case, best guess, and subject to revision.
I'd actually frame it as slightly conservative. There's actually some rates that are higher than the rates that are being requested to increase funding to, but we can make it work.
Okay.
Just one quick follow-up. Do we know how many positions is this?
I believe it is 6 positions.
Very good.
All right, on to
Representative Zager had a question. Sorry.
Thank you. So just to, if I understand that correctly, that's about $160,000 roughly per position, which is approximately twice the cost of the other nurse position that we just heard in the previous line item. Is that kind of like the ratio of that travel nurses cost about twice as much, at least in these hospitals?
I would hesitate to just do a blanket sort of twice as much. I think it depends on the position. Psychiatric nurse practitioners are going to be have a higher salary than some other positions, mental health workers or other clinicians in the hospital. The travel nurses here, there's 2 different rates that we're building in, $95 and $125 an hour.
Okay, thank you.
Okay.
All right, on to line 9. This is again in account Z225, which is the disproportionate share Dorothea Dix Psychiatric Center. This provides one-time funding for the Dorothea Dix Psychiatric Center's roof repair and replacement project. This is a one-time general fund appropriation of $620,000 in 22 and $1.2 million in 23.
And there's no comparable to what we have on campus for a building fund for Dorothea Dix or Riverview, a capital fund.
We don't have a capital reserve for our
Okay.
capital improvements. For either of the state hospitals, we request funding as needed, which is why you'll see this. And the next one is for bathroom renovations. There's a few other initiatives as well. So it's sort of pay as you go here in terms of facilities maintenance and investment.
Thank you. Senator Moore?
Hoping you can hear me. Do we not have insurance that would have covered the structural damage from the heavy rainfalls?
This isn't in with respect to a particular event or a weather event that happened. The Dorothea Dix facility, the complex is large, it's sprawling, it's also aging. And there's just investment that is needed over time. There are a couple places in the roof where there's actual leaking going on, which is past the point of when we should be renovating it, but we're asking for the funds now to do that and to make those investments to repair the roof.
Thank you. Woo.
All right, so we'll move on to the next line. Line 10. And this is also in the Z225 account, which is just for proportionate share Dorothea Dix. This provides one-time funding for the renovation of patient bathrooms at DDPC to make them ligature resistant. This again is a one-time general fund appropriation. This is of $650,000 in state fiscal year 23.
I'm not seeing any questions.
All right. Move on to line 11, again in Z225, Dish Dorothea Dix. This provides funding for the purchase of a patient monitoring system. This is a general fund appropriation in 22 of $60,000 and in 23 of $39,578.
Okay.
All right, line 12. This is again in account Z225, disproportionate share DDPC. This provides one-time funding for a hospital-wide upgrade of the Wi-Fi system at Dorothea Dix Psychiatric Center. This is again a one-time general fund appropriation in state fiscal year 23 of $285,750.
Next.
All right, so next is line 13. This is an account Z219, which is Riverview Psychiatric Center. And this provides funding for the contracted nursing positions at RPC. This is a general fund appropriation in state fiscal year 23 of just over $1 million.
So that would logically be 6 positions at different rates, as was the other case?
That's correct.
Okay.
All right. Next, line 14. This is again an account Z219 RPC. This provides funding for the purchase of a patient monitoring system. It's general fund appropriation of just over 100,000 in state fiscal year 22 and right around 75,000 in state fiscal year 23.
Yes, Representative Javner.
Is this patient monitoring system something new? I mean, I know they've had something in the past. Are they replacing a system that they have already?
Yep. Good question, Representative. So the staff at both hospitals are required to do, as you can see in the justification here, what's known as special observations. They make the rounds to check on the patients in the hospital on a regular basis. The recording and reporting of that is a manual process right now. This would provide funding to create a system, a web-based system, so that we can record those special observations and those rounds being done in a system which would help for real-time monitoring and notification and accountability and making sure that there's a more streamlined process in place for that for those special observations.
Thank you.
So it really is for documentation, not for remote video or anything.
Correct. The actual, the substance, if you will, of the special observations will be unchanged. Those will continue. I think the process of recording and documenting it and having the staff fulfill that reporting requirement will be improved.
Very good.
All right, line 15 is in account Z219, Riverview Psychiatric Center. This provides one-time funding for a hospital-wide upgrade of the Wi-Fi system at RPC. And it's a general fund appropriation one time in state fiscal year 23 of just over $133,000.
Okay.
All right, next. Lines 16 and 17, which are in account Z219, Riverview Psychiatric Center, and account Z220, which is the disproportionate share for RPC. And this establishes 4 psychiatric nurse practitioner positions, funded 36.53% general fund in the DISH RPC account, and 63.47% other special revenue in the RPC program account, to improve the recruitment and retention of qualified healthcare professionals and to avoid higher locum tenens contracts. This has a general fund appropriation in 23 of just over $353,000 and an other special revenue fund allocation in 23 of just over $630,000.
Yes, Senator Moore.
So by establishing them in this supplement, then I assume they will be in the baseline for the biennial. Is that correct?
That's correct.
Did you have a follow-up question, Senator Moore?
All right.
Okay.
Then we can move on to line 18. And this is an account Z198, Mental Health Services Community Account. And this provides funding to achieve parity with main care cost of living adjustments for certain community behavioral health services. This is a general fund appropriation in state fiscal year 23 of $280,145.
Yes, Representative Madigan.
Yeah, I would just appreciate more information on what community behavioral health related services. Do we know which ones this applies to?
Generally, they would, the objective of this initiative, which I think the committee has heard me say before, we tried to keep the state funded contract rates in parity with the main care rates. We recommended a COLA for a variety of main care rates, including behavioral health providers, starting in July of 2022. And this initiative would increase the contracted rates for non-main care services in line with that. This actually brings it up to the 4.9%. We've discussed previously that what is passed in the budget already is an increase of 2.3%, and then further down this document, we'll discuss the COLA initiative for main care to increase it to 4.9%. But this is any behavioral health services that are provided through contracts, through state-funded contracts, would be receiving the COLA here to keep them in line with the main care rates. There's a corresponding initiative here for SUD as well. This is just the mental health portion of it.
Okay, thank you. Well, I would like to just know more, like, as far as, you know, when we often talk about it in this committee, we often talk about kind of what section of main care it is, you know, or what the service is called under the main care reg. So at least for Thursday, if I could have that, if you don't have that, Mr. Mann.
Certainly.
Thank you.
Senator Moore.
That was basically my question as well, Senator Cox. And I was just wanting to know what sections does
Right.
this apply to? Because that's what we're hearing from our folks and the constituents, wanting to make sure we include the correct sections in that COLA adjustment.
And part of that is what sections aren't included.
So just to clarify, there won't be sections of policy. There isn't that this is outside the main care manual, but we can list the services that would be increased to for the 4.9% COLA that would
Great,
apply.
thank you. Thank you. Senator Moore, we have a little trouble with your audio at times, so just to let you know. Okay, go ahead.
All right, so next are lines 19, 20, and 21. And these are in the account 0563, which is childcare services, and account Z206, which is mental health services children. All three of these are providing allocation to align with available grant resources. The one in account 0563 is a federal block grant fund ARP account. So it's a allocation increase of just over 40.8 million. And then in Z206, there's one federal block grant fund increase of 5.5 million and one federal block grant ARP increase of just over 2.3 million. Again, these are all just allocation increases to get in line with the available resources.
And the 40 million includes the other two lines?
The 40 million is the total for the childcare services account 0563 allocation increase.
Yes, Representative Javner.
Thank you, Senator Claxton. The financial world is not my world, Luke. I'm sorry. So can somebody just really explain to me what this is saying to me? An increased budget is needed to meet available resources.
Yeah, so what that means is the revenue behind this is already, the department already has. They already have the money. What this allocation does is just gives them the ability to spend it. And generally, they can get that authority by just doing a financial order, which is often what's done throughout the year as this is needed. But when a budget comes along, the department likes to update their allocations so that what's actually in the budget for a specific line matches what their current estimated revenue is. So that's really what this is doing here, is it's just bringing the allocation, the ability to spend in line with the resources they have.
Thank you so much.
You're welcome.
So Luke, would we expect to be able to find numbers that added up to the 40 million figure by the time we got to the end of the document?
No, that's no. That initiative is its own thing.
Okay.
So what's really happening there is the department knows how much revenue they've received in their actual accounts for these particular items. They know what money is there. They're just asking for the ability to spend all of what they have. So the 40 million is essentially, there is a current allocation in that line for the federal block grant ARP, and they have money above and beyond that, over 40 million more than what they're currently allocated to spend. So they're just asking for that authority.
And the next two lines are part of the 40 or no?
No, they're all, I know this is what gets a little confusing when these get lumped together, but they're all part of one initiative, because what the department does is, as they're creating the budget, they come up with initiatives, and one of the initiatives they know they're always going to have is to increase allocations to be in line with their resources. And so there's actually multiple accounts that are included in the one initiative that are all separate standalone items. They're just asking for that allocation in multiple places. So the 40 million is its own, the 5.5 million in the mental health services children account is its own, and then the federal block grant ARP in the mental health services children of 2.3 million is also its own. They're separate requests for increased allocation to spend available funding.
But they're grayed out because they're part of that initiative.
Yeah, and it's just because in the end, the initiative gets filed as one big initiative, but it had many accounts in it. There was one of these earlier in the adult behavioral health, I think it was lines 1 through 3, where there were multiple accounts that were asking for increases in allocation that were all just part of one initiative. But they're all separate requests for increased allocation.
Representative Lemlin.
Thank you, Senator. How do we find out what this $41 million is going to be spent on? It just says child care services. How do we get a breakdown of that so we know where that money is actually going to and what it's going to be spent on?
I'm happy to provide an overview of that right now. So just to further build on what Luke said in terms of the allotment, there's 17 different accounts that are increasing federal allotment to align with available resources. We do this every year. There's a greater volume of this year given the funding that has come from the federal government through the various pieces of COVID-related congressional bills, whether that's the CARES Act or ARP or the Consolidated Appropriations Act that passed at the end of 2020 on December 27th, 2020. Those pushed out funding to states and particular accounts. And one of those accounts is the Child Care Services account here, 0536. And we are estimating a need of $40.8 million that we'll spend in fiscal 23 related to those funds that came from the federal government. That will continue the child care stabilization grants that are going to child care facilities right now. That is covering the $200 stipend for child care employees. It is also covering the subsidy off the offset of parent fees for families that are on the child care subsidy program. It's also, there's other adjustments that we've made to further bolster and support child care facilities, such as making payments based on utilization instead of enrollment and things like that. We have our whole child care plan posted on our website, which we can make the link available. It summarizes all of the plan to use federal dollars.
Just to follow up something you just said, Mr. Mann, the money going to the child care facilities is based on enrollment, not necessarily participation, right?
Correct. I think, did I say that in the opposite?
The other way around. Yeah. Okay. I just want to be clear about that. Representative Zager, you had your hand up?
You stole my thunder, Senator. Thank you.
Oh, my bad. Sorry. Thank you. All right. Luke? Let me go back to Representative Lemlin. Were you looking for a more detailed breakdown, Representative Lemlin, of the 17 accounts that are hit by this?
Yes, I was, but like Mr. Mann said, I guess I'm going to have to go to the website and look at it and see where exactly the money's going.
We could do it that way, or we could see if Molly could get us, make sure that link gets to us. Okay.
Sorry, I'm nodding at you, but you might not be able to see that.
I can't. You're not one of the 7 heads I can see. But I'm gonna fix that. Okay. Go ahead, Luke.
All right, so we'll move on to line 22. This is an account Z206. This is Mental Health Services Children. And this continues 2 limited period social services supervisor positions that were established in previous financial orders, and 3 limited period social service supervisors position, 1 limited period social services manager 1 position, and 1 limited period data and research coordinator position, 1 limited period clinical social worker position, 1 limited period social services program specialist 1 position, and 1 limited period social services program specialist 2 position. And this is all an allocation in the federal expenditures fund account, which is fund 013, and it's all in state fiscal year 23.
I'm not seeing any questions.
All right. So move on to line 23. This is in the Child Care Services account 0563. This continues one limited period social services program specialist 2 position, 1 limited period social services manager 1 position, and 2 limited period management analyst 2 positions. This is an increase allocation in state fiscal year 23, and it is a federal block grant fund ARP allocation.
Yes, Senator Moore.
Thank you, Senator Claxton. I guess my question would be in noticing the different dates, like in line 22, it was showing it through August 30th, 2024, yet this one is only through September 30th, 2023. I guess I'm curious why the different dates.
The System of Care grant, which is line 22, that the August 30th, 2024 is when the program period ends for that grant. The date listed in line 23, which is the 4 limited period positions tied to for childcare funding, is the end date of the limited period positions, which is why we're proposing to and need to propose it to continue through the budget if for those positions to continue. Which are tied to the increase in funding that we've received from the federal government to push out to childcare facilities.
Thank you.
Okay.
All right. And we're on to line 24. This is again in the Child Care Services account, which is account 0563. And this continues 1 limited period financial resource specialist position and 1 limited period community care worker position that were previously continued by previous financial orders. This is an increased allocation in state fiscal year 23 to a federal block grant fund.
Okay.
All right, so next is line 25, again in account 0563, Child Care Services. This establishes 1 public service manager 2 position funded 100% federal block grant fund in the Child Care Services program to serve as the Associate Director for Child Care and provides funding for related all other costs. This is an increased allocation in state fiscal year 23 of just over $142,000 in a federal block grant fund account.
Representative Lemelin.
Yes, sir. Thank you. Why are these childcare services not included in the $40 million?
They sort of are, actually. The reason for this initiative is we are asking to create a new position. You can related for the associate director for childcare. Currently, children's behavioral health and childcare in our Office of Family and Services is a combined program. Given the attention and the amount of work and funding going towards childcare recently, we're proposing to create a separate and distinct associate director position that would be solely dedicated to childcare services. We're not asking for general fund to fund that position. We'd be using the block grant to fund it. So it'd be 100% federally funded. But above the 40 million is just increasing allotment so that the department can spend, has the authority to spend the funding that it is receiving. This is creating a headcount, a new associate director position related to childcare.
Okay, I understand the need to have a separate line to add accounts, but is this an additional, are these 2 funds here, the 179 and the 142, additional money coming from the federal government, or is it taken out of the 40 million and it's just listed here as a separate amount because you have to address the additional employment?
it's not coming out of the 40 million. So prior to the 40 million was appropriated by Congress, through the American Rescue Plan. So while it is a multi-year appropriation, it is one time. It will that funding will go away eventually, but we are seeking the we're increasing our allotment to spend that funding. The funding that we're proposing to cover the cost of the associate director are coming out of the child care block grant, which is we have a permanent allocation from the feds related to that block grant, and we would fund this position out of that block grant baseline.
Okay, and what's the total amount of that federal block grant that you're taking out of? What's the total amount that we get?
I don't know that off the top of my head, but I can certainly get that for you. You want the baseline funding for the child care block grant outside of the funding that we've received through the American Rescue Plan or CARES Act or the other pieces?
Correct. I want to know where this money's coming from. That's all.
Yep, we can get that for you.
Thank you, sir.
Okay.
All right, so on to lines 26 and 27. These are in account 0923, the Homeless Youth Program account, and account Z206, the Mental Health Services Children account. This provides funding for homeless youth services in the Mental Health Services Children Program and the Homeless Youth Program. This is a general fund increase, and the two lines account for a total increase of $2 million appropriation in state fiscal year 23.
Yes, Representative Craven.
Thank you, Mr. Chair. Thank you, Mr. Chair. Are these youngsters that are living in the existing shelters and need mental health services? Is that how that works, and why don't they qualify for main care?
I think they might be in the shelter system. They might not be in the shelter system. I think both the service would be provided to both. There's significant outreach to try to provide support to them. So whether that's in the shelter system or outside of it, why they wouldn't qualify for main care, we can. Yeah, I think
they most likely do, right, Ben? I think this is an increase for the contracts for the youth shelters that I know we had a few bills that talked about them last year. And so this is an increase for the contract for those shelters. That is one service that some of these youth can receive. And, I can't speak to a person, but I imagine most of the youth are eligible for main care services and other support services through OCFS.
So the shelters then apply for the grants, and is that how that works?
It's not Ben, correct me, but it's not a grant, it's a contract. And so this is increasing the funding available to contract for the services that.
Thanks. Okay.
Yeah.
Yep. And what Molly said is exactly right. And additionally, there's we try to incentivize providers from moving folks off of state-funded services onto main care where possible. I think this population is a little more difficult to do that, but there's certainly efforts to do that, whether it's mental health or SUD or homeless services, to get them on a more permanent footing with Medicaid.
Thank you.
Senator Moore.
Thank you. Yes, what I was curious about is saying, how much have we actually budgeted for this service, for this contract in the past?
I can pull that number for you. It's a couple it's a couple $1 million or so. So it'd be a size, it's a considerable increase, but these, like the justification says, these the contracts have not been increased for many years, and they are in a dire need of being increased to make sure that the funding is adequate to support the services that are being delivered.
So as I read this, the RFP went out and came back with higher utilization driving increased cost. Is that fair?
Yes, I mean, the RFP, like you can see, was done in 2016, and it was chosen with the increased costs that came back. The funding was on the baseline, so the contracts remained the same. We went out to RFP again, and we have negotiated to try to arrive at a figure that works for both the providers and for us, which is what the request is now, which is right around $2 million based on the competitive sourcing of through the RFP, like you said.
So I would be interested in knowing how much we have budgeted in the baseline that this 2 million will be in addition to. That would be very interesting.
Certainly.
Yes, Representative Stover.
Thank you, Mr. Chair. And thank you, Deputy Commissioner Mann. I'm just curious on this same budget initiative. Is this sheltered services? Is this paying for, nightly rates for shelter, or is this initiative for social services connected to those same youth, like outreach services, community outreach? It's not clear in the description here whether it's reimbursement for the shelter stay or reimbursement for the outreach support. And I have one more question, if you don't mind. Is this for the low barrier shelters like Preble Street and Shaw House, or is it for the emergency shelter system, or both?
I will have to get back on the specificity of those questions. We outline here that it's for minimum wage increases over the years, the cost of food, maintaining services, maintaining the cost of just maintaining the shelters overall have increased.
So is it the shelter operating expense, like the non-Medicaid expense of operations?
Yes.
Okay, thank you. Thank you very much. That's what I was trying to get to.
Okay, any other questions? Okay, go ahead.
All right. Move on to lines 28 and 29. And these are in accounts 0137, which is the 4E foster care adoption assistance account, and the state funded foster care assistance account. And this provides one-time funding for child welfare cycle payments. This is a general fund increase. In account 0137, it's a increase one time in state fiscal year 23 of just over 6.8 million. And in account 0139, which is the state funded foster care assistance, it is a general fund increase one time in state fiscal year 23 of just under 4 million.
And go ahead, Representative Perry.
Yes, I think I need to understand, what are child welfare cycle payments?
This is reimbursement going out to foster parents and resource parents, whether those are been adopted or yet to be reunified.
And the increase is because of what?
So the cycle payments pay for the kids in care, whether they're in facilities or foster care. The increase is due to a couple different reasons. The number of kids in care has increased, There was, and when that happened, there was a reimbursement increase that was funded in 2018. But the Kids in Care has increased since then, so that incrementally increases the cost as well. The level of care for the kids has gone up, and mechanically over the years there was a carrying balance that accrued to cover the costs. We have run through that, used that carrying balance, so there's no we're unable to draw on those reserves, which is why we need additional funds to cover the cost of the Kids in Care today.
Thank you.
This is you know, the Kids in Care vary over time. We're asking for these funds on a one-time basis so that for fiscal 23, and we'll likely come back and we'll evaluate where we are a year from now for 24 and 25.
Senator Moore?
Thank you. One of the questions that I've been asked and I haven't got an answer to yet, how many licensed foster homes do we have in the state of Maine?
Are you talking about homes or individuals?
I guess individuals, like it would be the question.
Or positions?
Position. I'm just trying to figure out, you know, how cost-wise, you know, how many are we actually paying, you know, or providing funding to them for being foster parents or providing foster care?
Well, we're happy to get back to you on that. I don't know that, but we can get those figures for you.
Okay. All right.
All right, so we will move on.
I apologize, Luke. I just have a question.
Oh, I'm sorry.
It's okay. It's all right, Senator Claxton. So Director Mann, along with that information from Senator Moore, if we could also get, you know, what the rate is for right now for foster parents and for the adoption assistance, that would be great. Thank you.
And just to be specific, this is foster care, not kinship care subsidy. Is that right?
Foster care, that's right.
Okay, that's the 4E.
Is that inclusive of kinship foster care though, Ben?
It might be. I would have to get back to you, the committee, on that.
Yeah, I just want to be clear about which category or which categories we're talking about. Thank you. Okay.
All right, so we'll move on to lines 30 and 31. And both these lines are in the 0452 account, which is the Office of Child and Family Services District account. This establishes 16 Child Protective Services caseworker positions, 3 Child Protective Services caseworker supervisor positions, and 1 Public Service Manager 2 position, funded 79% general fund and 21% other special revenue in the Office of Child and Family Services District account. So this is a general fund appropriation increase in state fiscal year 23 of just over 1.7 million, and another special revenue fund allocation increase in state fiscal year 23 of just over $477,000.
Okay. Representative Lemlin?
Thank you. I guess I have confusion again. This is Children's Services, correct?
Child welfare?
Yeah, my question is, why are we using general fund money when we can use part of that 40 million for this?
This is child welfare. And the 40 million was related to child care.
So is that money available for spending on this, the stuff that was supposed to go to child care? Or does that come with guardrails from the feds?
They're completely different services. The child care is, you know, daycare for preschool across the state. This is child welfare related, doing investigations of abuse and neglect
Okay.
that is conducted by OCFS staff.
And the federal funds come through the Child Care Development Block Grant, which does have strings attached that
Sure.
direct it to childcare.
Okay. Senator Moore?
I'm just wanting to confirm that these are the 16 and 3 or the 20 positions that are going to help alleviate the overnight and the overtime and the weekend work. Is that correct?
Yes.
For the caseworkers. Okay, good.
Exactly.
Thank you.
Okay.
All right, so we'll move on to lines 32 and 33. And these are in the account 0452 Office of Child and Family Services District account. And they continue and make permanent 2 social services program specialists 2 positions previously established by a financial order, 79% general fund and 21% other special revenue in the Office of Child and Family Services District program. This is a general fund increase in state fiscal year 23 of just over $161,000 and an other special revenue fund allocation increase in state fiscal year 23 of just over $44,000.
Senator Moore?
I'm sorry, I hadn't lowered my hand, but I do have a question. I'm just confirming that this was part of the recommendation from the Casey Family Programs review. Am I correct in understanding that? So I thought,
That's accurate.
thank you.
So that's 32 and 33. Okay.
All right, so next are lines 34 and 35. These are both in account 0137, the 4E Foster Care Adoption Assistant Program. This provides funding for contracted staffing to support engagement between parents and the child welfare system. It is a general fund appropriation in 23 of $142,000 and a federal expenditures fund allocation increase of $60,000.
And this too was one of the Casey family recommendations.
Correct.
Okay.
All right. Next are lines 36 and 37. Again, both in account 0137 4E Foster Care Adoption Assistance. This provides funding to expand the Home Builders Prevention Program to serve reunifying families in all districts. This has a general fund appropriation increase in state fiscal year 23 of just over 1.5 million and a federal expenditures fund allocation increase in 23 of $638,000.
Yes, Senator Moore.
This was one of the items that was in one of the bills that we looked at yesterday. Well, which was the bill number on that one? I can't remember.
393.
393. Okay. Thank you.
And the numbers don't, as I recollect, don't exactly match, but they're close. Okay. All right.
All right, next is line 38. This is an account 0139, which is the state-funded foster care adoption assistance account. And this provides funding for the implementation of family visit coaching. This is a general fund appropriation increase in state fiscal year 23 of $2 million.
Okay.
All right, so lines 39 and 40, these are both in account 0307, which is the Office of Child and Family Services Central account. This establishes 8 secretary associate legal positions funded 72% general fund and 28% other special revenue funds in the OCFS Central program due to increased legal casework. The general fund appropriation in state fiscal year 23 is just over $485,000. And the other special revenue fund allocation increase is just under $200,000.
So this specifically addresses the timeframes issue that was raised with in the Casey evaluation in terms of getting from initial contact to a decision.
I think this will provide additional support within OCFS to, improve efficiency in working with these cases, but it won't have an impact on some of the other time challenges that you've heard, including working with the courts. So there's, this will certainly support additional work within OCFS, but I don't want to set an expectation that it will impact the timelines outside of the department.
No, we can't legislate the courts. Senator Moore?
How did we arrive at the need for 8 secretary associate legal positions?
I believe it's 1 for each district. And so these positions would, like Molly said, better allow caseworkers to focus on the work that they do and consolidate some of the court process, court filings, court documentation work that is increased over time and is a significant burden on caseworkers. So we would it further, I think, would support morale, and it would be good for retention overall for caseworkers to have this off their plate, so to speak.
Yes, Senator Moore?
Is there consideration, if it's going to be 1 for each district, is there the consideration of actually having them physically located in the districts rather than at the DHHS office in Augusta, per se?
We can confirm that, but I believe the expectation is that they'd be embedded where they're working, but we'll make sure that we have confirmation of that for Thursday.
Yeah, that's my understanding as well. I believe these would be in district offices, not in Augusta, but we'll confirm.
And those district offices have some proximity to the courts, right?
That would require some Google Maps, but I can certainly.
No, that's okay. That's okay. I assume each of them will establish a working relationship with the most local court.
Yes, I mean, this is all work that happens now. We're looking to
Sure.
make it more efficient. And so those relationships should already exist.
Okay. Very good.
Right, we'll move on to line 41. This is in the account 0563 childcare services. This establishes 1 social services manager 1 position and 1 management analyst 2 position funded 100% general fund within the child care services program. This initiative, along with including the all other costs of these positions, includes all other funding for salary supplements awarded to individuals who provide childcare or who are early childhood educators. This is a general fund increase in state fiscal year 23 of just over 12.1 million.
I don't see any questions.
All right, we'll move on to line 42. This is in the account 0103, which is the Ombudsman Program. And this provides funding for the Child Welfare Ombudsman Program. And I'll note that this really goes along with the language part BB, which we'll talk about a little later, sort of the overall changes within the Child Ombudsman Program. This is an increase of general fund in state fiscal year 23 of $140,000.
And just as a note for the committee, this is in addition to I think it was roughly 52 or 53,000 that the governor's office made available in the current budget. And so it's that's in Beth Bosang's testimony on 1960. And I know we've discussed it, but I just want to make sure that's top of mind as you're looking at that number as well.
Yeah, and thank you, Molly. That's why I had just changed my share screen to show the language part BB that we'll talk about a little later on the purple document. But I have the same note there that this is the same language that's in LD in the original bill of LD 1960. If there's any amendment after that, which there was, which added some additional pieces, but all of this language that's this part BB was in the original LD 1960, and that's what this line 42 that we were just talking about relates to. All right, we'll move on to line 43. And though I don't have these linked because they're not technically the same initiative, lines 43 and 44, I just wanted to point out that if you look at the allocations at the end, they offset one another. I believe the plan here is to reduce the allocation in the for one purpose and use that funding for a different purpose. So I'll go through line 43 first, which is account 0563, childcare services. This reduces the allocation for grants for the establishment and administration of the Help Maine Grow system and the First for Maine Early Care and Education Program authorized in Public Law 2021, Chapter 483, Part EE. Funds are available as provided in Public Law 2021, Chapter 457. So this deallocates funds from the Federal Expenditures Fund, ARP State Fiscal Recovery account. It's just over 1.1 million in 22 and just over 4.1 million in 23.
So before we get to the next section, which is about medical care payments, can we just take 5 minutes to get up and move around before we get into the thicker stuff with main care? So we'll be back in 5 minutes at 11:20. Thank you all. Okay. When you're ready, Luke, we can resume. And we'll tentatively go to 12:30-ish, break a bit for lunch, and then get back to work. The good news is that we're a quarter way through the pages. The bad news is that we're 1/6 of the way through the lines.
We are coming to a lot of lines that will have many, many lines as one initiative. So that will help move things along, I think.
I knew that. Thank you.
So I do want to step back to line 44 because I didn't actually read the initiative for that particular line. This was also in account 0563 childcare services. And this provides additional one-time funding for grants to renovate, expand, or construct childcare facilities to increase availability of accessible and affordable childcare. This is an increased allocation in the Federal Expenditures Fund, ARP State Fiscal Recovery account. And this, as I said, it sort of relates to line 43, where this was an increased allocation of just over 1.1 million in 22, just over 4.1 million in 23, which corresponds exactly with the amount that was on line 43 that was deallocated.
So this just changes the funding source.
Well, it changes what the funding is being used for by the new initiative text that you see tells you what that funding is now intended to be used for, as the funding that was originally going to be used for the Help Me Grow and for Maine early care child care system isn't needed for that anymore. So now it's being used for a new purpose.
Thank you.
Now we will move on to line 45, 46, and 47. And this is in the medical care payments to providers account 0147. In the Medicaid Services Developmental Services account Z7210, and Developmental Services Waiver Main Care account, which is account Z211. And this provides funding to replenish 50 reserve slots for individuals who have been determined as Priority 1 waiver program candidates under the Main Care Benefits Manual, Chapter 2, Section 21, Support Services for Adults with Intellectual Disabilities or Autism Spectrum Disorder. This is a general fund appropriation in 23 of just over 1.5 million. And other special revenue fund allocation increase in 23 of just over $300,000, and a federal expenditures fund allocation increase of just over 3.2 million in 23.
So Molly, it'd be good to know what the wait list looks like for this section.
Sure, we publish that information quarterly, and so I'll make sure that you have the link to those reports.
Thank you. Okay.
All right. I think it's probably worth noting specifically for section 21, the priority 1, there is no wait list for the priority 1, if I'm not mistaken. These are actually to have slots so that as new priority 1s come on, they're able to go right on the program. So I just wanted to make that clear.
Yes, thank you. That is accurate.
Yeah, and I should have been more specific. I was asking about 2 and 3. Yeah.
Okay. Next are lines 48, 49, and 50. These are in account 0129, the Office of Main Care Services. Account 0420, Long-Term Care, Office of Aging and Disability Services, and account Z208, Developmental Services Community. This establishes 2 Developmental Disabilities Resources Coordinator positions, funded 50% general fund in the Developmental Services Community Program, and 50% Federal Expenditures Fund in the Office of Main Care Services, and 1 Developmental Disabilities Resources Coordinator position funded 100% general fund in the Long-Term Care Office of Aging and Disability Services Program. So this has 2 general fund appropriation increases in state fiscal year 23. It is $92,000 in the Z208 Developmental Services Community account. It's also another $92,000 in 23 in the 0420 Long-Term Care Office of Aging Disability Services account. And there is also an allocation increase in the Federal Expenditures Fund in 23 of $96,000.
That's quite an extensive justification compared to some we've seen, to explain why, I guess. Okay.
All right, so we'll move on to lines 51 and 52. And this is in account 0129, Office of Main Care Services, and account 0147, Medical Care Payments to Providers. And this establishes allocation in the Other Special Revenue Funds, Medical Care Payments to Providers Program, and Office of Main Care Services Program for savings accrued due to an increase in the federal medical assistance percentage per the American Rescue Plan Act of 2021, Section 9817. I will note, so there's gonna be a lot of FMAP type increases. So I just want to be clear that this one is completely different from either the regular FMAP or the 6.2% FMAP increase that we've been getting during the public health emergency related to COVID. This is its own FMAP increase that is provided specifically for home and community-based services. The department had to provide a plan to the feds last year sometime that outlined what they plan to do with this additional 10% FMAP increase. And so I'm assuming that this, you'll see that the actual allocation increase in those other special revenue accounts is only $500. What that's really doing is establishing an allocation within these particular accounts. Once the department actually knows how much money they're really going to have in those accounts, they will, either through financial order or depending on the time through a budget, they would ask for an additional increase in the allocation to actually spend the funds. But for now, they're just establishing these new accounts so that this money, when it is finally received, can be spent for the purposes that are outlined in that spending plan that the department provided to the feds.
So it's a placeholder.
It is a placeholder for a plan that is already in place. They know what the plan is. The difference is they don't know exactly how much the funding will be because it is based on the actual amount spent in a certain time period.
Okay. I don't see any questions.
So we'll move on to lines 53 through 57. These 5 initiatives all relate to providing additional funding for services performed by the Office of the Attorney General. They're in multiple accounts. So account 0137 4E Foster Care Adoption Assistance, account 0453 Office for Family Independence District account, account Z040 the Office of Aging and Disability Services Adult Protective Services account, Z198 the Mental Health Services Community account, and Z208 the Developmental Services Community account. They're all general fund increases. And as it says, this is just for services currently already performed by the Office of the Attorney General.
Yes, Representative Jevner.
Thank you, Senator Claxton. Is it possible to have just some more information about what the rule changes have been and what the probate court procedures, how those have changed to increase this to this amount? Not today, of course, but just before Thursday, that'd be great. Thanks.
I'll just quickly today, I'll just note that this is predominantly related. I think undoubtedly there's been increases to the Office of the Attorney General, which has necessitated increases to their headcount. So since 2013, the Office of the Attorney General has added 18.5 positions in support of DHHS programs. The department has not requested nor received commensurate funding to fund those positions. And this initiative provides that funding to cover those costs. And there's annual increases, and cost of providing services goes up annually anyway, and it trues that up.
And I think Representative Javner, just for an explanation of where it says rule changes, what that really is, it's not about a rule changing that means they have to increase what they pay to the Attorney General. It's every time the department does rule changes, part of the process is that they're reviewed by the Attorney General. And so with all the rule changes that are necessitated by either the biennial budget, a supplemental budget, or all the bills that get passed, all that work, part of it is to go to the Attorney General's office for a review. And I think that's what the rule changes that's noted in the justification is.
Thank you. That makes perfect sense. And I'm sorry, Deputy Mann, can you just remind me what year did you say 18? So you said 18 and a half positions have been added to the Attorney General's office since when?
2013.
Thank you.
Certainly. And just it helps maybe to connect this. There's a separate initiative in the budget for to add an additional headcount to the Office of the Attorney General. They're requesting that headcount, but we have the funding. It's a separate and distinct initiative from this one, but that's how this should work. We're requesting the funding, they're requesting the headcount. We'll have the funds going forward to cover the costs for that position. We'll cover that coming up here later in the document.
Thank you. Okay.
All right. Next, we'll move on to lines 58 through 61. This is in accounts 0142 DHHS Central Ops, account Z219 Riverview Psychiatric Center, and account Z222 the Dorothea Dick Psychiatric Center. This provides funding for technology and services provided by the Department of Administrative and Financial Services Office of Information Technology. It's a general fund increase in state fiscal year 22 of just over 230,000 in one line and just under 30,000 in another. And in 23, similar amounts. And then there's also an other special revenue fund allocation increase in 22 of 158,000 and same amount in 23. Oh, sorry, and there is one more general fund appropriation increase, the last line there of 26,000 in each year of the biennium.
So this is somewhat similar to the OAG in that expenses go up year over year and, okay. Representative Javner?
Thank you, Senator Claxton. What are network fees?
So Senator Claxton's correct in that this is similar to the OAG. We are OIT, main IT funds itself by charging departments for the costs, and essentially a revolving fund. They changed the methodology for printers and network connections. Those are basically like LAN connections, like where you plug an Ethernet into. There are infrastructure fixed costs and variable costs related to maintaining those services for departments. That methodology has changed to increase the cost to the department. So we're requesting the funds that new costs have been imposed on the department. And like I said, asking for those costs to be covered here.
Does that answer your question, Representative Javner? It's a new way of expensing the cost of support from OIT, from the Office of Information Technology. And that generated a change in what they're billing. I assume this happens in every department, but is particularly prominent here because of the size of the department.
Yes.
Yes, thank you.
Does that help?
Yes, it does.
Okay. I saw that happen at the hospital when they changed, they were charging by printer and by computer, and it just got to be too crazy to keep track of all who was hooked up and who wasn't. So they just had to change the allocation process. Senator Moore?
Yeah, that brings up another question. I know earlier we talked about expanding the Wi-Fi at Riverview and Dorothea Dix. Will the internal OIT be doing that upgrade, or will it be an external company doing it?
Good question. We worked in coordination with OIT to develop those quotes, and we'll work with them to install it. it'll be contracted out.
Okay, thank you.
Very good.
All right, move on to line 62 and 63. Both of these are in account 0142 DHHS Central Operations. This provides funding for an increase in real estate taxes and other rent-related expenses at the Department of Health and Human Services building located at 109 Capitol Street, Augusta, as well as a base rent increase. This has a general fund increase in state fiscal year 22 of just over $172,000, and in state fiscal year 23 of just over $220,000, and an other special revenue fund allocation increase in 22 of just over $119,000, and in 23 of just over $150,000.
I don't see any questions.
Move on to line 64 and 65. These are both in account 0142 DHHS Central Operations. It provides funding for risk management insurance rate increases. It's a general fund appropriation in 22 of just over $181,000, and in 23 of just over $193,000, and an other special revenue fund allocation increase in 22 of just over $122,000, and in 23 of just over $130,000.
Yes, Senator Moore.
I'm just curious, what is the percentage of increase that the insurance went up? Do we know for this period? By chance?
That's a good question. I don't know off the top of my head. I can certainly pull that figure and let you know what the 193,000 is in fiscal 23 over the current baseline.
Thank you. I'm just curious, actually. Thank you.
Okay.
All right, move on to lines 66 and 67, both in account 0142 DHHS Central Operations. This establishes one senior legal advisor position funded 60% general fund in DHHS Central Operations and 40% other special revenue in DHHS Central Operations. This position includes some language in language part DD, so I'll quickly jump over and show you that language. This is just the summary of the language, which notes that it adds the DHHS senior legal advisor position to a list of positions appointed by the commissioner and adds the senior legal advisor to the list of positions whose salary are subject to adjustment by the governor. This has a general fund appropriation in 23 of just over $107,000 and an other special revenue funds allocation increase in 23 of just over $74,000.
Senator Moore.
Okay, my question then would be is that if we have 18 and a half people in the AG's office that is dedicated to DHHS, why do we need a legal advisor within the department?
That's a good question. I think there's a lot of coordination work. We're proposing to create this position. There's a lot of legal adjacent work that goes on, whether it's FOAs or contract reviews that the OAG does not currently support. And I do think the Office of the Attorney General is supportive of this position. We've proposed it previously as well, and it would help with the coordination between our two offices and to make sure there's attention on the right spots of core legal work that's going on here that the OAG is doing on behalf of the department, and then the work that's going on at DHHS as well.
Senator Claxton, I'm sorry, I have a question.
Thank you. Go ahead.
Deputy Mann, so what's the importance here of the piece that this position will be appointed by the commissioner and not somebody that's just hired out?
Yeah, there are a couple other departments in the state that have appointed general counsels, senior legal advisors. DHHS is not one of them. DHHS is the largest department in the state. It would be, my position is appointed, Molly's is appointed, as we would like to make this position part of the core senior leadership team of the department. And the way to go about doing that would be to make it an appointed position.
So that this arises in conjunction with the OAG.
It does not. This would be a DHHS position. That would be, the headcount would be part of the department and funded, and we're requesting the funding for it.
But the initiative was developed with OAG.
Yeah.
Correct.
Yes.
That's all I meant. Yes.
Yep.
Okay.
They're aware and supportive of it. Yes.
Any other questions? Okay.
All right, move on to line 68 through 71. This is in accounts 0137 4E foster care adoption assistance, account Z198 mental health services community, and account Z208 developmental services community. This provides funding to reimburse the Office of the Attorney General for one full-time Assistant Attorney General position dedicated to DHHS. This has a
I was going to say those lines are actually attached to 68 as one initiative. Is that what the?
Correct. 68, 69, 70, and 71 are all one initiative.
Yeah.
The funding is just being broken out into the multiple accounts that essentially will cover that position.
Okay. Okay.
Senator Claxton?
Yes. No,
I know
I'm trying to take notes and look through
I
them.
know, exactly. I understand. That's why I'm just speaking up. So this position is completely different than the position is going to be appointed by the commission. All right. So this position right here on line 68 is going to be attached to the AOG's office.
Yes. This is the one I referred to previously. It's easier to talk about now, obviously. This would be a position that would work in the OAG's shop on behalf of DHHS initiatives, similar to, I believe they have about 80 positions that support DHHS. Don't quote me on the exact figure there, but and we are only requesting the funding to pay for this new position. So this would be new capacity for the OAG.
Thank you.
Okay.
All right, move on to lines 72 and 73, both in account Z036, Division of Licensing and Certification. This establishes one Public Service Manager 3 position, funded 35% general fund and 65% other special revenue funds in the Division of Licensing and Certification program to serve as the Chief Operations Officer. This has a general fund increase in 23 of just under $50,000 and another special revenue fund allocation increase in 23 of just under $95,000.
Representative Perry?
For the Division of Licensing, what would the Chief Operations Officer be overseeing?
Thanks for that. This, just as background, our DLC, Division of Licensing and Certification, currently does not have a COO role. So, and this would create that deputy role under the director. They've been central to the COVID response, and whether that's federal compliance or accountability or support of long-term care facilities, hospitals, all of the required regulation that goes along with those, the healthcare industry. the particular position here would provide oversight and management of rulemaking, management of appeals, preparation for hearings. There's other training support that DLC manages, like certified nurse assistant issues. So it would be a myriad, it would basically be a deputy position for the director of DLC.
Thank you.
Okay.
On to line 74, again in account Z036, Division of Licensing and Certification. And this adjusts funding to align with existing resources. This is an other special revenue funds allocation increase in 23 of $314,000.
Okay, Representative Zager.
Thank you, Mr. Chair. I have sort of a general question, and then this may have been answered a year plus ago or so. But when talking about all these positions, approximately what percentage of the allocation is salary? I presume some is salary, some is benefits, and probably some other things. And so is there a rule of thumb for that for all these positions?
A good question. I actually, I would guess it's around 30 to 40% benefits, but I can confirm that and get back to you. There's also, so the majority, the balance, 60 to 70% would be salary, then the benefits on top of it. There's a small piece associated with most positions that fall into the all other category, so the non-personnel services account, and that's for provisioning of technology and the proportion of the real estate cost that is assigned to that person. There's just that's probably just a couple percentage points.
Okay, thank you so much. That gives me a sense.
Senator Moore.
Thank you. On this particular line here where it's talking about the background check program, do we think that the increase in cost is because we are, we passed that one law to actually require the background check, and the state is covering the cost? Is that what falls into this category as well?
That sounds plausible. I would need a little bit more information on that. I do know, which would align with your comment there, that the number of background checks we are performing has gone up, and it's a per capita cost here. So we have the funding for it. This would just increase the allotment permanently. So by the amount you see there, $314,000. So we can continue. We have sufficient resources, sufficient authority to spend what we need to.
And I can offer just a little bit more about that. I think maybe what you're thinking of is the department bill to require what were termed high-risk main care providers to receive a background check. And that actually is a very small number of providers, but in the last few years, we have been increasing, for example, fingerprinting of childcare providers who are required through the federal block grants to have those background checks. And so I think it's a confluence of an increased number of checks that are leading to the cost, but we can drill down on that a bit more.
Representative Griffin.
Thank you, Senator Claxton. I know I should know this, but could you just remind me what, Luke, if you could just remind me what the other special revenue funds are, what that is?
Well, and yeah, in the past, I often provide you a sheet that outlines for all the different other special revenue accounts what the fee or revenue source is that's for that other special revenue. I can send that out to the group again, just so that you have it for all of the different lines. But we do know that for this one, it specifically is the revenue that comes in from the main background check programs.
Yeah, it would be great to have that information again. Thank you.
Okay.
All right, so we'll move on to lines 75 through 77. This is in account 0129 Office of Main Care Services and account 0140 Office of Aging and Disability Services Program. And this transfers and reallocates one social services program manager position from 50% general fund and 50% federal expenditures fund in Office of Main Care Services Program to 100% general fund in the Office of Aging and Disability Services Central Program to align the funding with the work that is currently being performed. The net cost of these three lines, it nets out to zero. But of course, since it's moving from what is 50% general fund to 100% general fund, there is an increase overall in the general fund appropriation within the program.
Yes, Representative Jadner.
Thank you, Senator Claxton. Kind of some information about what is in the justification paragraph, it says the supplement 3 and 4 vaccine disparities and outreach grants. What are those?
Those are federal funds that came through the American Rescue Plan, particularly to states for vaccine administration and education and awareness. Those funds are being used right now, and part of the responsibility of this role is to work with older Mainers on the vaccine effort.
If I may follow up,
Yes,
please. Is that specific to the COVID-19 vaccine or all vaccines?
COVID-19.
Okay.
Move on to line 78. This is an account Z208, Developmental Services Community Account, provides funding for the approved reorganization of one social services program specialist 3 position to a social services program manager position to better align the position with the work that is being performed. This has a general fund appropriation in 23 of just over $14,000.
Okay.
Line 79 is in account Z208 Developmental Services Community, provides funding for the approved reorganization of one management analyst 2 position to a comprehensive health planner 2 position to serve as the communications manager for the Office of Aging and Disability Services. This has a increased general fund appropriation of just over $10,000 in 23.
Yes, Senator Moore.
So basically, in both of these, it's really that we are promoting them to the next, to a different level of staffing. Is that correct?
That's exactly right.
Okay.
We, in an effort to minimize new headcount, we look to also, as an alternative to that, we look to upgrade certain positions to provide more capacity. And these two, and I believe one more in ODES, also follows that same model.
Okay.
All right, lines 80 and 81 are in account 0129 Office of Main Care Services and account Z208 Developmental Services Community. This provides funding for the approved reclassification of 2 mental health and developmental disability caseworker positions to human services caseworker positions retroactive to September of 2020. This has a general fund increase in 22 of just over $21,000 and in 23 of just over $12,000, and a federal expenditures fund allocation increase of just over $7,200 in 22 and just over $4,200 in 23.
Okay.
Line 82 is in account 0140, Office of Aging and Disability Services Central Office. This provides funding for the approved reorganization of one social services program manager position to a public service manager 2 position to align with the work being performed by the position. It has a general fund increase in 23 of just over $27,000.
And is it fair to say that, as Senator Moore asked, these are essentially promotions? They're not redefinitions of the job? Or are there promotions with redefinition of the performance expectations?
It's the latter. We're changing the classification of the position. And just for awareness, since Representative Javner asked, this is related to, I believe, row 70, FA 1622. So we're moving off of main care onto a general fund, 100% general fund, and then upgrading that position as well, which is why the description of the work being performed in the justification is similar in both instances.
Thank you. Okay.
Lines 83 and 84 in accounts Z198 Mental Health Services Community and account Z199 Office of Substance Abuse and Mental Health Services. This provides funding to achieve parity with main care medication management rates increased in Public Law 2021, Chapter 398. There is a general fund increase in 22 of right around $630,000 across both lines, and in 23 of right around $800,000.
I don't see any questions.
Lines 85 through 88, and these are in accounts 0129 Office of Main Care Services and account 0142 Department of Health and Human Services Central Operations. This transfers 2 Public Service Coordinator 1 positions, 1 Public Service Manager 1 position, and 1 Management Analyst 2 position from 50% General Fund and 50% Other Special Revenue Fund in DHHS Central Operations to 50% General Fund and 50% Federal Expenditures Fund in the Office of Main Care Services. So you'll see that if you look at the last column, these numbers net out to a total general fund increase of 0, but there is the other special revenue becoming Federal Expenditures Fund. So those are allocations, but the net of all of those is 0.
Okay.
Right, lines 89 and 90 are both in account 0129 Office of Main Care Services. Provides funding in the Office of Main Care Services program due to an increase in cost for financial, accounting, and human resources management services provided by the Department of Administrative and Financial Services. This has a general fund increase in 23 of just over $108,000 and a Federal Expenditures Fund increase in 23 of just over $111,000. And I would just note this is similar to what was discussed earlier about both OAG and the DAF's OIT increases. This is for the other services provided by DAFs for DHHS.
Thank you.
Next is line 91, account 0142 DHHS Central Operations. It provides one-time funding for public health emergency transitional case management services to those in need as federal COVID-19 related funding expires. So it's one-time general fund appropriation in 22 of $200,000 and in 23 of $550,000. So line 92, this is an account Z018, which is Main Care Stabilization Fund. This is actually just a line that gets added here as part of the language part FF. that notwithstanding any provision of law to the contrary, the state controller shall transfer $30 million from the unappropriated surplus of the general fund to the Maine Care Stabilization Fund account established in Maine Revised Statutes Title 22, Section 3174 KK on or before June 30th, 2022. You'll see there's no dollar amounts listed in the state fiscal year 22 and 23 accounts lines. That's because this is just a transfer. It's not an appropriation or an allocation of any funding. So this, as I said, goes along with, and I'll move over to the purple document quickly just to show you that Part FF is the one that requires the $30 million transfer. Moving on to lines 93 through 95.
Senator Claxton, I had just
I'm
a
sorry,
question.
Senator Moore.
Do we know what the balance is in the Maine Care Stabilization Fund?
As of right now, I believe, and I actually meant to go back and look at this just to make sure, but I believe at this point it only has 14.5 million in it. Back in, when did we do this now? It was in the 129th legislature. There was an initiative to move a total of 29 million into the Maine Care Stabilization Fund. 14.5 million of that was from general fund and 14.5 million was from Fund for Healthy Maine. And the Fund for Healthy Maine money has since been transferred back to Fund for a Healthy Maine because that was always intended to only be there for that biennium if it was needed. So there currently is 14.5 million, and I will go and make sure that account, that I'm right with that accounting of the money.
There was,
Thank you.
I'll let Luke follow up, but in a previous budget, there was transferred an additional $40 million into the account. So there should be 54.5 million.
Okay. Thank you, Ben. That's what I could not remember, and I meant to go look that up.
Okay.
Next are lines 93 through 95. These are all in account 0140, Office of Aging and Disability Services Central Office account. This provides an allocation to align with available grant resources. It has a federal expenditures fund allocation increase in 23 of 105,000, and another federal expenditures fund increase in 23 of just under 2 million, and then a federal expenditures fund ARP increase in 23 of just over 2.7 million. Next is line 96. This is an account 0420, Long-Term Care Office of Aging and Disability Services. Provides funding to reduce the wait list for the Office of Aging and Disabilities, Chapter 5, Section 63, In-Home and Community Support Services for Elderly and Other Adults program. It's a general fund appropriation in state fiscal year 23 of just over 6.1 million. I will just note, because these questions often come up, in the justification, it does note that as of August of 21, there were 1,147 individuals on the wait list for these services. And this particular initiative would remove 600 individuals from that number.
So since we created this initiative, I'll just note that we just finished updating the wait list, and the current wait list is between 400 and 500 folks, but with the anticipation of additional services being requested between now and the biennial budget, would recommend keeping it at the funded 600 slots of what this initiative puts forward right now.
Senator Claxton, if I may.
Please, Representative Jadner.
So then are you is the department therefore really meaning to go forward and to with these numbers that we're looking at here to clear that wait list, or is that not the option?
It would, the current initiative here would clear the current wait list.
Thank you.
Right, lines 97 and 98, which are both in the account 0129 Office of Main Care Services. This establishes 3 comprehensive health planner 1 positions, 1 medical care coordinator position, and 1 management analyst 2 position, funded 50% general fund and 50% federal expenditures fund in OMS. This initiative also transfers all other personal services to cover a portion of these positions, which were previously procured through a staff augmentation contract. This has a general fund increase in 23 of just over $95,000, and a federal expenditures fund allocation increase in 23 of just over $98,000.
Senator Moore?
So if these are long-term contracted staff currently, when does that contract expire?
Basically, besides IT contracts, almost overwhelmingly most contracts in the department, and I believe statewide, are either 1 or 2 years. So we continually need to re-up these. I would just, as context for you all, these positions were state lines. They were outsourced previously, and we're looking to bring them back in as state lines. They are performing what I would consider inherently governmental work. And we're looking to, like I said, restore the state line positions for the Office of Main Care here.
Okay.
All right, so next are lines 99 through 102. These are the first of a few FMAP lines. So this is all in account 0147 medical care payments to provider account. And this adjusts funding as a result of the decrease in the federal medical assistance percentage for federal fiscal year 23. I will note that these 4 lines are specifically for the impact of the decrease on the CHIP accounts, the Children's Health Insurance Program accounts.
So Luke, what is the percent decrease then of the FMAP across the board?
Sorry, I didn't quite understand that.
I'm sorry. I'm just was wondering, I know in the past it's always been like minus 6.9% or something. So I just was curious, what is the percentage of decrease across the board of the FMAP?
Well, specifically for CHIP, it's going from 74.8 to 74.3.
Okay. So that's the difference. But it's not a straight across the board. I mean, I understand this is CHIP, but the others are all going to be different then.
Well, Maine's decrease is going to be different than all those states because there's the whole calculation that's used by the federal government to decide what the new FMAP will be. And it's all based on your state's relative change compared to other states. So even if overall, and I'm sorry, I'm totally blanking on the particular thing they use. And Ben, I know you're
per capita income.
Thank you. So even if Maine's per capita income is down, but it's not down as much relative to other states, we could have a decrease in our FMAP. So there's a whole calculation that the federal government uses to do this. So Maine's enhanced FMAP, which is the one that's used specifically for CHIP, is going from 74.8 to 74.3. And you'll see in the initiative justification for the other FMAP exactly what the change is there as well.
Does that answer your question, Senator Moore? Okay.
And just we're going to cover it in the intervening initiatives as well, but just to build on what Luke said, the Maine's per capita income went up relative to the national average, which makes the FMAP rate go down, which means that we need to request general fund dollars to cover the same services. It's just the share of the FMAP of what the federal government cost covers.
And I do also, one of the extra documents that I sent to all of you, and I will go to it once I've gotten through this FMAP, the next group of FMAP lines. There is a document that just shows what the overall impact to the general fund is of the CHIP FMAP increase or decrease and the FMAP decrease for all other as well. So I will go to that after this so that we can see the full impact on the general fund.
Okay.
So the next initiative is lines 103 through 114. It affects multiple accounts, so I won't read through them all, but this is the one that adjusts funding as a result of the decrease in the FMAP for federal fiscal year 23. For the regular FMAP, it went from 64% in Fed fiscal year 22 to 63.29% in Fed fiscal year 23.
And you referenced the blended rate. How is that used versus the rate per year?
The blended rate is just what the state has to do to try and identify, because our fiscal year is different than the Fed's. The Fed fiscal year runs from October through September. The state's fiscal year is July through June. So when trying to calculate how much of an impact the federal FMAP change is going to have, you take the first quarter for the state fiscal year stays the same, and the other 3 quarters change when the federal FMAP changes. And so you blend that to just try and calculate what you think the impact will be on the state of that FMAP change.
So these numbers in the last column are anticipated based on the blended rate.
Correct.
Thank you.
And so now I am on the document that I created that just shows what the FMAP change impact has. And as I said, it includes both the CHIP and the regular FMAP. So I will just go to the bottom so you can see the overall impact. And you can see that it's asking for an additional $17 million of general fund appropriation in 23. And then you can see the decreases that are there in the federal expenditures and the federal block grant and the other special revenue, which are the 3 areas that are the federal funding. There is also an additional Fund for Healthy Maine allocation request of $473,000. That's because there are some of the Fund for Healthy Maine accounts that are used to draw down federal funds. And so this decrease will require an additional Fund for Healthy Maine allocation to offset that.
Okay.
Senator Claxton, real quickly. So Luke,
Yes,
does that
please.
mean that excuse me, Luke, are you going to go over those white sheets with us separately, or can we ask questions as we go
No,
along?
you can definitely ask questions now.
So so from what I'm seeing here, the general fund is going to have to be increased by 17 million.
Yes,
What it is. So that's
Yep.
the difference. Okay. Thanks.
that's the net of all the general fund requests. Next are lines 115 through 118. And this is the adjust funding, it's in account Z219, which is RPC, Z220, which is DISH RPC, Z222, which is DDPC, and Z225, which is the DISH DDPC account. And this adjusts funding for the positions in Riverview and Dorothea Dix as a result of the decrease in the federal medical assistance percentage. And as it says here, the blended rate is 63.47. So in Riverview and Dorothea Dix, the FMAP is used to calculate a certain portion of the funding, and this is just reallocating that based on the new FMAP. And this has a general fund increase. There are two general fund appropriation increases in 23, one for $181,000 and one for $132,000. And I will just note that those were included at the bottom of that document we were just looking at that has all the FMAP changes. So that 17 million that we just talked about included these lines.
Which net to zero.
They net to zero, but it is a general fund
Yeah.
appropriation increase. Yes.
Yeah.
Next are lines 119 and 120. And these are both in the account 0147 medical care payments to provider account. And this provides one-time funding for COVID-19 supplemental payments to hospitals. This is a general fund appropriation request in 23 of just over 6.7 million and a federal expenditures fund allocation increase in 23 of just over 18.2 million.
Yes, Representative Jabner.
Thank you. Just real quickly, why were the ARPA funds not utilized for this payment?
So the department received funds in specific accounts for specific purposes. We don't, there wasn't a direct appropriation to the department for this. The provider relief fund that was created through first through the CARES Act and then funded again through subsequent pieces of legislation did push out funding to healthcare providers across the country, predominantly hospitals. So there were significant resources. Maine hospitals received nearly $500 million in funding for directly from the provider relief fund from those various pieces of COVID legislation.
Thank you.
Next is lines 121 through 144. Again, this is in multiple accounts, so I won't read each individual account. I'll just read the initiative text, which notes that this repeals the consolidation of main care related programs and accounts contained in Public Law 2021, Chapter 398. That public law is what was the second portion of the biennial budget that was done last year. This was something we discussed quite a bit during the biennial budget process last year. There is language that goes along with this, language part EE, and this was the department's approach to try and consolidate many of the various accounts down into a much smaller number of accounts. It sounds like from what the department has stated, they just, with all the other work that was involved with initiatives that either came out of the budget or that were passed last year, there just isn't going to be the time to do the work that's needed to do this account consolidation. So that's the reason for the repealing of it now. I know at the public hearing, they also noted that I think that it's likely that this will come back again in the future, but for now, they just don't have the time to do the work that's involved. And so they're repealing this. And I just wanted to show one of the separate documents I provided was all the lines that are included in this account consolidation. And the main thing to show you there is that it all nets to zero. There's no general fund increase. There's no allocation increases at all. All it's doing is moving between different accounts, but at the end of the day, it nets to zero. Representative Jabner, it looks like I might have answered a question you might have had.
You're so smart.
He's good. He's good. Further evidence of how lucky we are in this committee to have the resources we do. Okay.
So with that, we'll move on to line 145. Look at how many pages we get to fly by right there. So next is lines 145 through 152. This is a much discussed initiative. This is specifically the initiative that there was a joint hearing with the AFA committee that the department sort of presented this initiative to you and walked you through the reasons for it and the costs involved. So this is lines 145 through 152. It's in multiple accounts, but this provides funding to reflect updated cost of living adjustments and to ensure labor components of rates equal to at least 125% of the minimum wage for services under Public Law 2021, Chapter 398, Part Quadruple A.
So this is both the COLA and the attempt to get to 125%.
Correct.
Representative Perry.
Yeah, I just have a question. This is for home and community-based services. Am I correct on that?
There's many sections of policy included in this. It's not just one.
The other question I have, and I know I've asked this question, so I'm hoping it will come up, because developmental disabilities had a change in not the salary rate, but a change in the administrative rate. And at some point, this may not be the place for it, but I would like to get some more information about that.
So I just wanted to show I've moved to the separate document that I created just for this initiative. You'll note that we just talked about the initiative that goes through line 152. The next initiative that's coming up is lines 153 through 159, and that's included on this document as well, because these two initiatives kind of go together to be the full amount of the request. And I'm just showing you here the bottom line to show you the general fund impact of this is 6.9 million in state fiscal year 22 and 28 million in state fiscal year 23. And that total is the amount that was discussed at that previous hearing, including on I think there was a separate spreadsheet that I sent along to all of you that outlined the total impact over the biennium. And it does match exactly with what is here on this document.
I quadruple checked it.
Yes.
For those of you who are listening, that's a reference to Part Quadruple A.
Which has been said many, many, many times over the last many months. So, so next are lines 153 through 159. And as I said, this relates to the initiative above, but this is specifically provides funding due to the increased inflation rates for main care services required to provide a cost of living adjustment.
So just for a little bit more context here, just to answer Representative Perry's question as well, the previous initiative was for the sections of policy were all included in Quadruple A. This initiative here is for the sections of policy that were not included in Quadruple A and are not otherwise receiving a rate increase, or, for example, we are benchmarking to Medicare rates as well.
Thank you.
Okay.
All right, next is lines 160 through 162. And these are in account 0147 main medical care payments to provider and account 0202 low cost drugs to Maine's elderly program. This provides funding for Medicare Parts A, B, and D premium rate increases. This has a general fund impact in the medical care payments to provider account of 5.3 million, just over 5.3 million in 22 and 27.8 million in 23. And in the drugs to Maine elderly account, this is general fund appropriation increase of just over 68,000 in 22 and just over 594,000 in 23. Additionally, there is a federal expenditures fund allocation increase in the medical care payments to provider account of just over 8 million in 22 and just over 17 million in 23. So next are lines 163 through 178. And this adjusts funding for the 6.2% increase in the federal medical assistance percentage rate. And this specifically relates to the increase that the state is receiving for as long as the public health emergency for COVID-19 continues. So this, I provided, if I can find, here we go. So I provided a document that is just this particular FMAP increase because it is quite different from the other FMAP increases. So just so you know, the overall, this is decreasing general fund appropriations by 137 million in 22 and increasing the federal expenditures fund allocation by 142 million. There's also a decrease in the federal block grant allocation and in the Fund for Healthy Maine allocation.
Can I ask a question?
Oh, sure, Representative Perry.
In terms of the fact that, you know, we've got the benefit of this FMAP as long as it's considered a public health emergency. The designation comes from the federal government, I'm assuming.
Yes.
And when that designation changes, how much lead time is there for the states to really change what they need to do?
So the state is going to get the 6.2% increase in any quarter in which the public health emergency still exists. So currently, and I'm now trying to step back because there would have been, or has it come yet? Because now the most recent designation was in January. And I'm not sure we've seen one in March yet. And I'm sort of looking at Ben because I think he's on top of that a little more than I would be.
The public health emergency in mid to late January was extended to April 18th. So the 6.2% goes through the fourth quarter of the state fiscal year. So this initiative covers last quarter, the current quarter, and the next quarter, which is trues up the amount of the enhanced FMAP tied.
So
to the
that gives
health
us
emergency.
time to plan forward. It's really what I'm looking at.
Correct.
Okay.
Next are lines 179 through 185. These are in accounts 0147 medical care payments to providers, account Z211 developmental services waiver main care program, account Z212 developmental services waiver supports program, account Z217 Medicaid waiver for other related conditions, and account Z218 Medicaid waiver for brain injury residential community services. And this provides one-time funding for increased non-emergency transportation broker rates. And this has multiple general fund increases and federal expenditure and federal block grant allocation increases. It looks like the general fund increase is around 350,000 in 22 and closer to 400,000 in 23. Next, we'll move on to lines 186 and 187. These are both in account 0147 medical care payments to provider. This provides funding to implement new rates based on the fiscal year 23 rate study for inpatient psychiatric services. It has a general fund increase in 23 of 1.7 million, just over 1.7 million, and a federal expenditures fund allocation increase in 23 of just over 4.3 million.
Look, I think Representative Zager is trying to get a word in.
Yes, Representative Zager.
Thank you, Mr. Chair. Just please, going back to line 179, it has specific mention to gasoline costs. Will Russia's invasion of Ukraine be expected to increase that that estimate?
Not for the current fiscal year, rates are set. So this for fiscal 22, we will be all set with the funding provided there. Fiscal 23 is an estimate at this point, and will likely be here a year from now to true up the amount of the actual NET rates, the non-emergency transportation rates for fiscal 23. We do this every year. It's an actuary report to determine the broker rates for this program. So if gasoline prices are increased over the next year, I would assume the fiscal 23, or at least that will be one component of the rate that would be in consideration, taken into consideration for the upcoming fiscal year.
Okay, so we'll know more in a year. Is essentially what we're saying. Okay, thank you.
Non-emergency transportation comes up basically every budget because we just establish the rates as we go. It sort of feels like FMAP in that respect.
Okay, thank you.
I'm going to turn the chair over to Representative Meyer for a couple minutes, and we'll look for a convenient spot to take a break for lunch. Be right back.
All right, so before I move on, anything on lines 186, 187 about the new rates for the inpatient psych services? Okay, not seeing anything. I'll move on to lines 188 and 189. This provides funding for the removal of member copays for federally qualified health centers, FQHCs, and rural health clinic services, RHCs. This is an account 0147, medical care payments to providers. There's a general fund appropriation in 23 of just over $25,000 and a federal expenditures fund allocation increase in 23 of just over $61,000. All right, move on to lines 190 and 191. These are both in the medical care payments to provider account 0147. This reduces funding one time to reflect different planned effective dates and approved effective dates in Resolve 2021 chapters 111, 112, and 118. And this is a general fund decrease in 22 of just under $640,000 and in 23 of just under $615,000, and a federal expenditure fund allocation decrease in 22 of just under 1.1 million and in 23 of just under 1.1 million. Next is lines 192 and 193. These are in the account 0147 medical care payment to providers account. Provides one-time funding for COVID-19 supplemental payments to family planning agencies. It's a general fund increase in 23 of just over $37,000 and a federal expenditures fund allocation increase in 23 of just over $99,000. All right, line 194. This is an account Z198, mental health services community.
1 second, Luke. Yes, Senator Moore.
Yes, I guess I probably need to ask, just for my own sake and remembering it, who are our family planning agencies?
Sure. So that's family planning agencies that accept main care. So that's the branches largely Planned Parenthood and Maine Family Planning across the state.
Okay. Thank you.
Great. Move on to line 194. Account Z198, Mental Health Services Community, provides funding for private non-medical institution rental subsidy contracts. This is a general fund increase in 22 of just over $744,000 and a similar amount in 23. Lines 195 and 196 are in account 0147. The medical care payments to providers account provides funding to increase rates for psychiatric residential treatment facility services. This has a general fund increase in 23 of $332,000 and a federal expenditure fund allocation increase of just over $611,000.
Yes, Representative Zager.
Thank you, Madam Chair. I was just wondering if we could get a sense of how many psychiatric beds have the availability of psychiatric beds have changed in the state.
Are you asking, excuse me.
With respect to psychiatric residential treatment facilities, which is a particular type, there are no beds in the state. This type of facility doesn't exist in the state. So we are looking to establish one, though, to provide a full continuum of care, and are looking to increase rates to try to incentivize that to happen.
That's for substance recovery, right?
The PRTF? No, not necessarily.
Okay, but we have there are many psychiatric inpatient psychiatric beds that are not these PRTF.
These are for youth, correct, Ben?
Yes.
Yes.
Okay, so we have a separate line item that for adults that
We can, yeah, I mean, to answer, yes, we can try to pull together the answer to your question, on psychiatric beds.
I appreciate that, and I'll just share, like, I was recently in an emergency room and just saw the backup, when there's not the availability for folks to to have inpatient psychiatric beds. It's really quite a hazard and not good care, and so that's kind of, I'm trying to understand the system dynamics.
Yep, we can do that. Just to connect the dots, the row 186 is that previous initiative does increase the rate, which is currently undergoing a rate study for inpatient psych services in the state.
Representative Jaffner.
Thank you. So when will that rate study, when's it slated to be ready?
We're looking, we'd be looking to implement the rate study for January 1st, 2023 effective date.
And just to clarify that the rate study will happen this year and the new rate would be implemented January 1st, 2023.
Go ahead, Luke.
All right, move on to line 197 through 199. This is in the medical care payments to provider account 0147 and the PNMI room and board account Z009. Provides one-time funding for a high main care utilization add-on payment to private non-medical institutions that care for residents who are older or disabled. This has two general fund increases. In the medical care payment to provider in state fiscal year 23, it's just over 2.4 million. And in the PNMI room and board, the general fund appropriation increase in 23 is just over 2.5 million. There is also an other special revenue funds allocation increase in 23 of just over $300,000.
Representative Perry?
Yes, thank you. I'm sort of looking at this. Help me. PNMICs, are these what we call also assisted livings for the elderly? Or are we also including nursing homes with that?
No, you're right. Assisted living or residential care facilities.
Yeah.
Did you have a follow-up, Representative Perry? Your hand's still up. Okay, go ahead.
All right, the next lines, which are 200 through 217, are something that we do basically every budget to get lines in it, to get the different lines to align with the Revenue Forecasting Committee. So there's multiple accounts here. I won't read through all of them, but this adjusts the funding in various main care accounts to reflect impacts from the December 1st, 2021 Revenue Forecasting Committee projections. And I'll just say, because I often get this question, no, there's nothing yet about the March revenue forecast that was just completed. That would have to come later, but for now, this is getting us caught up to the December 1st revenue forecast changes. And I do have a document that just lays out these changes. So I'll go to the bottom there so you can see the overall impact is an increase in the general fund appropriation in 22 of just over 2.6 million, and in 23 an increase of just over 1.3 million. I do also have a document, which this is something I do just to account for these changes. This is just me going in and saying, I know exactly what the numbers were in the December 2021 revenue forecast, the final numbers. I go into the accounting system and see where all those numbers are. And then I just come up with what that difference is to make sure that the numbers that I get match up with the budget initiatives, in this case, in the supplemental budget. And I can say that they were exactly the same. So this initiative looks like it does match up perfectly with the, oh, and now everything went away on me. That's lovely. There we go. So that looks like that initiative worked out. It does align with December revenue forecast. There's nothing else. I'll move on to lines 218 through 224. There are multiple accounts here, so I won't read through them all individually, but this initiative provides one-time funding for add-on payments to account for recent increased staffing costs, including costs associated with COVID-19 for nursing facilities and residential care facilities. This has multiple general fund appropriation increases and also multiple allocation changes associated with it. Next, I'll move on to lines 225 through 230. These are in the account 0147, medical care payments to providers account, and account 0148, nursing facilities. And these provide one-time funding for COVID-19 supplemental payments to long-term care providers. And this is just, these increases are just in state fiscal year 23. The previous initiatives increases were just in state fiscal year 22. And so now I'll move, this is a separate document I created just for you to see. This lays out all the different one-time COVID payments that I could find in the supplemental budget. So I think this one that we're on now is the last one there that we're going to see. So I just wanted to show you that this document does lay out all the individual changes, but overall these one-time changes just for COVID-19 in the supplemental budget have an increase in state fiscal year 22 of just over 2.1 million to the general fund and of just under 15 million in state fiscal year 23. Next, we'll move on to lines 231 and 232. And these are both in the Office for Family Independence account 0453. This establishes 14 limited period eligibility specialist positions and 1 limited period family independence unit supervisor position funded 37.9% general fund and 62.1% other special revenue funds within the Office for Family Independence until June 15th, 2024. This has a general fund increase in state fiscal year 23 of just over $474,000 and an other special revenue fund allocation increase in 23 of just over $805,000. Next, we'll move on to lines 233 and 234. These are both in account 0143, Maine Center for Disease Control and Prevention. It continues and makes permanent 1 Public Service Manager 2 position, previously continued by previous financials funded 60% general fund and 40% federal expenditures fund in the Maine CDC account to serve as the Associate Director of the Office of Health and Population Equity. This has a general fund increase in state fiscal year 23 of just over $93,000 and a federal expenditures fund allocation increase in 23 of just over $64,000. Next is line 235. This is again in the account 0143, Maine Center for Disease Control and Prevention. Provides one-time funding to support the purchase of a more effective and reliable child lead case management system for the lead poisoning prevention program due to the current system being outdated and not designed to handle the current caseload size. As it says, this is a one-time general fund appropriation in state fiscal year 23 of $200,000.
Just for additional information, for the committee, the current case management system was designed to handle test results that were received several years ago, well before the legislature enacted universal lead testing for children. And so the magnitude of the cases that the system is looking to track has increased significantly.
Next is line 236 in account 0143, Maine CDC. Provides one-time funding in the Maine CDC general fund to relocate the health and environmental testing laboratory in its entirety from 221 State Street, Augusta to the East State Office Complex Campus Greenlaw Building in Augusta. So it's a one-time general fund appropriation in state fiscal year 23 of $845,000. Next is line 237 and account 0143.
Just a real quick question. Is that going to complete the renovation and finalize it, or are they going to still be working on it into the next budget?
A good question. This funding is just actually for the move from 221 State over to Greenlaw. The current construction of the new state lab on the Riverview campus at the Greenlaw building slated to be completed this summer.
Oh, great. Awesome. Thank you.
So next is line 237. This is in account 0143 main CDC. This provides one-time funding to purchase PFAS testing equipment for the Health Environmental Testing Lab. It's a general fund increase in 23 of $1,004,000. Next is line 238. Again, in account 0143 main CDC. This establishes 2 Chemist 2 positions and 1 Chemist 1 position and provides funding for PFAS testing capacity in the Health and Environmental Testing Laboratory. It's a general fund increase in state fiscal year 23 of just over $600,000. Next is lines 239 through 246. This is the last group of these lines, which provides allocation to align with available grant resources. We've had multiple others of these throughout. These are all the ones that are related to public health, social services, and substance use disorder. So there are just a number of allocation increases here. Next is line 247. This is an account Z289, the Opioid Use Disorder Prevention and Treatment Fund. This provides an allocation in the Opioid Use Disorder Prevention and Treatment Fund program to align with the available resources. This is an other special revenue funds allocation increase in 23 of just over 2.4 million. And the last initiative is line 248. This is an account Z199, the Office of Substance Abuse and Mental Health Services, and it provides funding for the continuation of the overdose prevention through intensive outreach, naloxone, and safety options liaisons in all of the main counties. This is a general fund increase in state fiscal year 23 of just over $805,000.
Senator Moore.
There. What I'm wondering is if this 805,000, will we be able to use some of the opiate settlement money maybe for funding the options program or the liaisons? I know we haven't got it yet, but just a thought.
This program's operating right now, and the reason we're not asking for funding in fiscal 22 is because we are using federal dollars to support it, but would like to institutionalize it. It's become a model other states are using as well. Maine was one of the first, if not the first, to embed these liaisons with law enforcement to try to divert individuals from hospitals or being incarcerated. So the general fund, in my estimation, would be the appropriate place to embed this program, just so it has a stable footing going forward.
Yes, Representative Jaffner.
Thank you, Madam Chair. Is it possible just to get more information concerning the options program and the success of it, and what are the metrics that we're utilizing to see what the success rate has been for this program?
Sure.
Any additional questions or requests of the department for information moving into? Yes, Representative Zager.
Thank you, Madam Chair. Line item 145. I was rereading the initiative justification, and it talks about the labor components. I'll give you a moment in case you're not there to go back, because I realize that backtracking a little bit.
Sorry, Representative Zager, which lines were you specifically going back to?
It may be in more, but I was looking at 145. This is regarding Chapter 398, Part Quad A. The 125% minimum wage.
Okay.
So my question is, this was, we increased the labor component, or we increased the minimum wage to 125% of minimum wage for those DSPs. What other components are there, and what changes have there been, if any, to those? In other words, this specifically talks about the labor components. I remember there was something in our joint hearing with AFA, and maybe it's just to reiterate what you shared then, but interested in more clarity on that. I also want to just broadly say I so appreciate Deputy Commissioner Mann, your work, and Luke, your work on this entire process. It's gargantuan, and I just salute you guys for and others who are involved.
Appreciate that. Thank you, Representative. It's there. This initiative, as we've discussed, there's a lot of moving pieces to it. I'll just try to summarize in the this initiative 145 through included to 152 affects the sections of policy that were enumerated in Part Quadruple A, and addresses both COLA and 125% of minimum wage, that provision. The 125% provision addresses just the wage components of the rates that affect wages, obviously. The COLA affects the entire rate overall, but we've merged those together because it makes sense to do this one time, starting making it effective back to January 1. So there were two different initiatives. Last year in the biennial budget, the governor proposed cost of living adjustments for rates that would not be receiving COLAs or other rate increases, and that affects the entire rate. And the LD 1573 was introduced, which was just the labor components of those rates to make sure that those components of the rate were increased. We've combined those into this. I think Luke provided several briefings, and I discussed before this committee and AFA. We walked through the various, we broke it out by, you can see the COLA piece, and you can see the 125% piece by section of policy.
And is this affecting PNMIs as well? Is it?
It affects, so PNMICs at Res Care, assisted living, receives COLAs by statute already, so they wouldn't be included in this. PNMIDs received a substantial increase effective on November 1. That's kids residential, Appendix D, but Appendix E and Fs would be included here.
Okay. I was visiting and talking with some PNMIs in my district, and there was concern that there was that the program costs were decreased as the labor wage components were increased, such that there was not a net improvement, it was a net decrease. So looking for clarity on that when we get back together, not this moment, but thank you very much.
We can provide some of that information on Thursday. I do want to be really clear that there's a significant net increase in these rates over the last year in all of the rates that we're discussing. And there are multiple components in a methodology that are determined through rate study, and main care is much more equipped to talk about what those are and how they, cumulatively spit out what the rate is going to be. But there has been no net decrease in any rates.
Okay. Well, thank you. And I appreciate the chair's indulgence.
Representative Perry.
Yes, actually, Representative Zager has brought up one of the things that I wanted to know. And I really would like to get some good information on the administrative rate decrease that has occurred. I'm not talking about net at this point. And I would like to actually see the rationale and what brought about the decrease in the administrative payments.
And Senator Moore.
Thank you, Representative Meyer. What I would also like to see related to the same topic is the actual sections that are getting the COLA and the actual sections that are getting the 125% increase. That would be really good for comparison, because I'm feeling like we're kind of a little bit all over the place. And I'm hearing one section isn't getting the 125, but they are getting the COLA. So that would be very helpful if we could have a combined list to just identify what's falling under this initiative.
Any other questions, requests? Seeing none, Luke does have the purple document, which he would like to get to before we break. If the committee agrees, we'll trudge forward. I'm told it's not going to be terribly long.
Yes, there's only a few lines here.
Great, carry on.
So, and we've talked about some of these already as we went through the initiative document, because most of these language parts also have a piece in the initiatives that we just went through. So I'll start with, again, we're looking at the purple document for those who have a beautiful purple piece of paper. This is line 249. So this is language part BB. And I won't read all the pieces here, but this is the one that we discussed that is the original LD 1960 bill that you guys have all already worked through. This makes many changes to the Ombudsman program. And as I said, line 42 in the initiative document relates directly to this. It's the additional funding required, and this is all the language that goes along with those changes. Seeing no questions, I'll move on to line 250. This is language part DD. And this is the part that adds to the Department of Health and Human Services a senior legal advisor position to the list of the positions appointed by the commissioner, and adds a senior legal advisor position to the list of positions whose salaries are subject to adjustment by the governor. This relates to lines 66 and 67 in the document we just went through, which we discussed briefly. Next is line 251. It's part EE. And this part repeals the language associated with the consolidation of main care related programs and accounts approved in Public Law 2021, Chapter 398. Due to technical adjustments that would need to be made and the volume of main care related systems work already in process, this initiative cannot be completed within the required time frame. This relates to lines 121 through 144 of the initiative document. Next is line 252. This is language part FF, and this is the part that requires the transfer of $30 million in fiscal year 2021-22 from the unappropriated surplus of the general fund to the main care stabilization fund account. This relates to the line 92 on the initiative document. Next is line 253. This is language part GG. This part authorizes the Department of Health and Human Services to transfer savings incurred from the increase in FMAP per the American Rescue Plan Act of 2021, Section 9817, from various general fund main care program accounts to other special revenue fund accounts in the medical care payments to provider and Office of Main Care Services program to be used for federally authorized purposes. This specifically relates to lines 51 and 52, which, if you remember, were allocation increases that were just $500 in each of those accounts just to set up the accounts. What this allows for is as the money is identified as saved, which is due to the 10% FMAP increase, that money can then be moved from the general fund accounts to those allocations within medical care payments to provider and Office of Main Care Services admin accounts. And the last one is line 254, which is language part HH. And this part allows the Department of Health and Human Services Office for Family and Dependents to carry forward any unexpended balance of the $1,335,770 appropriated in Public Law 2021, Chapter 1 to meet reinvestment obligations for penalties incurred in the Supplemental Nutrition Assistance Program in 2019. And that is all the language in the supplemental budget. So that gets us through all the initiative and language that we needed to walk through for today.
Questions or requests on the purple document? Seeing none. That concludes your presentation today, Luke.
It sure does.
Well, on behalf of the committee, I want to thank you and Mr. Mann and, of course, Molly Bogart for being here today and moving through the documents with us. We will see you on Thursday. Yes, Representative Stover.
I'm not sure where this fits, so I'm just going to put it out there. I'm just wondering, in all of our discussion, I didn't see, and I might have missed it, any discussion of the rates on crisis beds for people with IDDD. And I just wondered for maybe Thursday, if we could, if there is any initiative. I don't even know how many crisis beds still exist for people with intellectual disabilities, developmental disabilities, and how many, if they exist, are currently staffed because of the staffing shortages we've discussed extensively throughout this session. And if we have a sense of that, how many are actually needed? How many do we have? How many are needed? And are there some sitting empty because they can't be adequately staffed? And I wonder if we could just have that at a future discussion. Thank you.
Seeing no other questions, I would ask Sam and Anna if there's anything else on our agenda today. That looks like a no. Senator Claxton, are you saying something because you're on mute?
I said, wow, we're done a bit earlier than I anticipated.
We are. And with that, I would entertain a motion to adjourn.
So moved.
All in favor? See you tomorrow in Augusta.